Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's understand the COX-2 inhibitors. So we look at the COX-2 inhibitors as well as some very important points. So first is the COX-2 inhibitors. They are aka known as the COXIBs. So they are different from the non-selective COX inhibitors as they have a very few side effects. So the important one being they have a few GI side effects. Next one is there is no antiplatelet action. So there is no antiplatelet action. So by antiplatelet action is there is a thromboxane A2 production is unaffected. So thromboxane, if we see thromboxane A2 production, it is unaffected. Next is we move on to the adverse effects as well as the contraindications. So there is adverse effects and also the CI, that is a contraindications. So here in adverse effects there is the MI, next is the stroke, then comes the congestive heart failure, next is the hypertension as well as the renal impairment. Now let's look at the order of the COX-2. The order of the COX-2 selectivity. So the first one being the Lumira COXIB. So we have the mnemonic LERVC. So LERVC. So let's break it down. The L stands for the Lumira COXIB. So everywhere we have the COXIBs. So first is the Lumira COXIB, followed by the Itori, followed by the Rofi and the Valdi. Lastly, there is a CELI. Next is we have the CELI. So Lumi COXIB, Itori COXIB, Rofi COXIB, Valdi COXIB or the CELI. So it is LERVC. So out of all this, the Lumira COXIB is the most selective. So there is Lumira COXIB. So this Lumira COXIB is nothing but it is the most selective. Then moving on, we also have the CELI COXIB. The CELI COXIB was last in the order, so this is going to be the least selective. So there is only one COXIB which can be given parenterally. So parenterally, there is only one COXIB which can be given. So that COXIB is nothing but the pari-COXIB. So P for P. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.